Welcome, welcome, welcome. This is Akila.
And I'm Samia.
And welcome back to episode 2 of
Sistars in Medicine.
Well, we embark on hard conversations regarding medicine, its effects on us as providers, and its implications in the community. We will be uncovering research, sharing personal stories, talking about medical trends, and pressing issues that shape our healthcare system today. We are here to empower and to inform.
Yes, indeed. Yes, we are. But before we really get into it today, I thought that we could get started with just a little bit of a check-in. We kind of check the pulse, fill the room, and maybe even share a moment of gratitude. What do you think about that?
Yeah, I like that. I think that we should do like this little check-in, check the pulse before we get into any of our episodes to kind of like see where we're at this particular moment as we do some very thorough discussion. So I will go first.
Okay.
I want to first start off by offering my gratitude to you, my sister. I'm grateful that I'm sitting here with my sister creating something together. It's not every day that we're able to combine family and passion. So I want to say thank you to you, Samia, for sharing this journey with me. And I think that this is going to be an amazing adventure.
Oh, thank you. I guess we're just on the same kind of wavelength today because I also wanted to provide some gratitude for you. I wanted to say just that I'm grateful that we have the opportunity to be in the same city at the same time.
Yes.
It's been a very long time. And being able to work on something that we're both very passionate about, and for you being both one of my original role models, and being able to sit across from you and do this work with you is very something that I'm grateful for.
Oh, you're welcome. That means a lot to me. It is actually a true honor to be sitting here in this particular space and having this forum to like actually speak and talk about things that we're definitely passionate about. I think it's been ingrained in us since we were children to actually care about people.
100%, yes.
And that exudes throughout our, existence as individuals and as providers. So I'm very much thankful for what you have just said. Your words mean so much.
Yes.
So let's go into a little brief recap of the first episode. If you weren't here to join us,
Yes.
you should run it back and listen to that first episode.
Indeed.
But in our last episode, we delved into the origins of our podcast title, The Sistars in Medicine and Black Pride. We explained how the name was carefully chosen to highlight the intersection of Black identity and the biases that exist within the healthcare system. We also explored the personal significance of the word Sistars, which reflects our own bond as sisters and healthcare providers, and how that connection influences the heart of our work, our core.
Yes.
We took some time to introduce ourselves, share a little bit of the why we created this podcast and how deeply meaningful it is to us. As it's the core of our mission, it is to confront the radical and racial inequities in healthcare, advocate for real change, and create a space for thought-provoking conversations. Our goal is to spark dialogue around race, equity, inclusion, not only for those within the medical field, but for anyone who is passionate about social justice and striving for a more equitable world.
And now we wanted to just talk a little bit more about our own specific journeys into medicine and healthcare. It has been said that no two journeys are the same, and that very much rings true for the two of us. We have had our own unique experiences and challenges. We've had our own different highs and lows, and even just our journeys into healthcare. What that looks like is very different, and all of those kind of different pieces have shaped our careers in very different ways. But things that have always run true is our common shared value of our goals, our deep passion, and just very much being rooted in the community and taking care of the community. So Akila.
Yes.
Tell me a little bit about your early inspirations.
Oh
into
my
medicine.
goodness. My earliest inspiration, Medicine started out as a fascination. Like, I was really into science. My mom had a background in research and development.
Yes, she did.
And that very much sparked something within me. And I was always someone who wanted to learn about why things happen. You would do something, you would say something to me, and my response would be, oh, why? You can't just tell me anything. I want to know what the root cause is. I want to know why things happen, why people say the things that they do. And that's why I think that I'm very good at what I do currently, because I'm always trying to strive for something better. And I would say that my biggest fascination was, as I stated in the first episode, about brain surgery, about neurology. I fell in love and in awe with someone by the name of Dr. Alexia Kennedy, who was the first African-American woman to become a brain surgeon.
Yes.
I studied her journey. I would look up brain surgeries in books in the library. I studied her pathway. What I admired most about her was her unwavering dedication to serving underserved communities. So that truly speaks to me to this day. So it was definitely impressionable. Along with much of the influence from my parents, of course, her stance on going against the status quo spoke to me. She was an advocate for breaking personal barriers, but about lifting others up. So she didn't just care about herself and making that path and creating a successful career, but also, bringing her people along with her to be successful. Her work has also inspired me to keep pushing for change, to advocate for equity, and to always remember the communities that we serve. I remember where I'm from, where I'm rooted, and when I get to where I want to be, they will all reap the benefits, right?
Yes.
So that's kind of like my early inspiration in regard to my pathway here in medicine. But let's hear about you. I know, but I want the people to know. So you can go ahead and speak on that.
Yeah, I think that the funniest thing about it is that my kind of inspiration for service, because that's what I think it really is, my inspiration for service has everything to do with our parents. I think that from a very young age, I understood that the only way to be in this world was to be giving back. That it was not just about you, but it was about how you were going to show up and do for others.
For sure.
And that rung true in how our parents were, in the way in which they raised us. And so from a very young age, I always was trying to kind of figure out what would be my intervention in the world. Even when I said in the first podcast, or the first episode rather, that at 6 years old, I wanted to be a doctor, that had a lot to do with just my interest in like healing. I was fascinated with red blood cells. I saw a picture of red blood cells in a cartoon, and I was like, oh my God. Look at that thing. That is so interesting. They look like little donuts without holes, and it's just moving through our blood system. And you will know me soon, but I love donuts. I will travel the world for vegan donuts. I love them. And I was just very much fascinated with this idea of healing, how you could cut your finger, and within a few days, within a few hours, it would stop bleeding. Within a few days, it would start to heal. And within a week, it would be perfectly fine. I always thought that was very fascinating. And I wanted to know more about that process and dive into figuring that out. And so I merged my two very strong passions about healing and the process of healing and the curiosity around healing and this commitment to service together. And for me, those landed with healthcare and with medicine.
Yes. All right. Yeah. So early on inspiration that led us to our pathways to different pathways in medicine. And I want to speak to my medical education and how I navigated that space, how I spoke about a little bit into it in regard to the first episode. But I just wanted to talk a little bit about my journey. I want to let everyone know you're never too old to do what you want to do. You're never too old to re-spark some passion and follow through with it. Like you can have things that you've dreamed about in terms of your career. Like, there are no boundaries. So I want to say that because I went back to nursing school when I was 30.
Yes, you did.
I went back to school and was like, this is what I want. This is what I am going to do. And I did it.
Yes, you did.
But the journey was not easy. I got into nursing school that was 3,000 miles away from everything that I knew. I sacrificed the relationship that I was in to go ahead and pursue, you know, my aspirations in that regard. But I knew at the end of the day, it would be the betterment of all. But like I said, 3,000 miles away from family, loved ones, and was in an accelerated program. For those of you who don't know, accelerated programs for nursing is set up for individuals who already have a bachelor's degree, who have completed their nursing prerequisites. I can't even talk because I'm just so traumatized by the experience. Prerequisites for nursing and enter a program that's super fast. That's why it's called an accelerated program. I was in a program at Drexel University in Philadelphia, and it was 11 months. 11 months of, I don't even know how to put this nicely. The word is torture. It was torturous.
Yeah.
I had moments where I thought I was going to quit, throw in the towel. I had moments where I was crying. Samia had came to visit me and support me. Listen, you guys, support. She lived with me for 3 months
I did.
in Philadelphia.
Yes.
She doesn't know how much that meant to me. I needed the support. I just needed the support. She was there for me. She helped cook for me. She pulled me up when I was down, crying, waking up in night sweats, crying about like what I was going to do for the next exam. It was an adventure, but I got through it, prepared for the NCLEX, which is the examination that you need to take in order to be a registered nurse. I passed that. And then started the journey of, you know, getting a job is another barrier that you know, must overcome. And it took me probably 7 months before my first interview for a job. That very first interview that I had, I did not get the position. So I applied again. And this second time around, which was probably like maybe a month later, I actually had 2 offers on the table. And I ended up accepting one, and that was going into liver transplant ICU. So going from no nursing experience into something so intricate, such as liver transplant, I was mind blown. There was so much information coming at me at one time. Luckily, I did not experience a unit that wasn't supportive. I was in a very supportive transplant unit that supported me in terms of my learning. I never felt that I was bullied at any time, even though that would have never been an option anyways, but I never felt that anyone tried to attempt to bully me. It was just a very good first nursing experience. And from there, I knew that I wanted to transition into the NICU, the neonatal ICU. And something that kind of sparked that interest was actually one of my other sisters. She had an experience with one of her children being in the NICU, and I just fell in love with how the nurses cared for her, as well as my nephew in that specific space, and that just drew me in. So my path was trying to apply to any NICU and any space in California, and nobody was hiring because everyone knows that no one leaves the NICU. Everyone loves the NICU. Yes. They only retire out of the NICU. So it was definitely a process. But finally, I got the opportunity to become a NICU nurse in 2 different locations and ended up spending almost 7 years as a NICU nurse.
Oh, wow.
And I decided I wanted to be a midwife, kind of shift that focus. into, bringing life into the world. The NICU can have some of those more sad moments because the babies are very sick sometimes and the outcomes aren't so great. But I just wanted to kind of shift into the midwifery aspect for various reasons that we'll discuss a little bit further into this podcast. But in order for me to do that, I had to go back to school. So this is going to be my third time going back to school.
Yes.
So went to apply for programs. I got into a few programs, but decided to make sure that I had options. So I ended up going to Georgetown to their dual practice program, which offered a degree in women's health nurse practitioner as well as midwifery. So I did this program, which was not easy at all, specifically because it happened during the pandemic. In this space during the pandemic, my mother got ill. She's now recovered in remission.
Yes.
And towards the end of it, my father got ill. And sadly, he's no longer with us physically, but he's here spiritually. So it was quite a roller coaster for me in the space of getting my graduate degree. There are many times where I felt like the universe was trying to tell me something like, girl, this ain't it. Put up the books. But I pushed through. I had so much support and motivation from my siblings. I have 5 of them, including Samia. My siblings, my family, and I got through it. And here I am, sitting here and certified.
Yes.
And practicing.
Yes.
And doing what I know will make a difference in my space.
Yes. Bringing those babies into the world.
My God, bringing the babies in, you guys. We'll get into this, but it's amazing. And I feel so blessed to be doing that.
Yes, very nice. Well, thank you for that reflection. And just to kind of add to that, as we mentioned, like our journeys are very different. I finished undergrad and had no idea what I was going to do. I was torn between 2 different type of journeys and pathways, one a PhD route and one to pursuing a medical degree. I came back from undergrad and really just kind of laid on the floor. I had no idea what I was going to do. And the bridge between when I finally applied to a master's degree or graduate level program, I did a lot of different things, a lot of different jobs, mostly in education. But I found myself working as a medical assistant in San Francisco, where I got to just be reconnected with healthcare and folks doing really incredible work, mostly midwives and nurse practitioners, who are the folks who I like to accredit for my re-spark and re-interest in medicine.
Yes.
I applied to medical school, which means that I had to sit for the MCAT, which I had to take 3 times, which was not fun and was expensive,
Yes.
to be quite frank. And doing my kind of odd end jobs to make ends meet in order to pay for these exams was both frustrating but also just something that I knew had to get done. I did okay. I was like, meh, so with the MCAT. And then I applied to I first applied to medical school about 5 years after I had finished undergrad. I didn't get into any programs, and there was a admissions kind of counselor for a medical school, an osteopathic medical school in Michigan, who sent an email who offered to just review my application to see what were some like gaps or spaces and areas of growth in my application. I initially wasn't going to respond to that email or take them up on that offer, but I decided to.
Yes, and we're
And
glad.
thank you. And she had said that, honestly, the only thing for your application is that it just looks like you've been out of school for a long time, and admission boards don't know if you can really do this work just because it's been such a such a long time from when you finished your kind of academic rigor to where you are now.
Right.
And she had actually suggested that I do a master's program instead of something called a post-bac. So a post-bac is a post-baccalaureate program. So that's for folks who have finished their initial undergraduate degree. So your bachelor's of arts, your bachelor's of sciences. And it's when you're kind of changing careers that are really related to the sciences.
Right.
So you can apply for very expensive programs that kind of have you take all of the prerequisites for medical school or whatever it is, the science field that you're going into. And sometimes those are hit or miss. You can spend a lot of money and not matriculate into a medical school.
Right.
So she advised me to actually do a master's because she said at least at the end of it, you'll have a degree and you can do
Yes.
whatever you can or whatever you would like to with that degree. And that really resonated with me. I was like, you know what? Yes, I can have a higher level degree and I can still decide whether or not I want to continue on this journey into medicine. And so I took her advice and I did apply to master's programs, and I applied to one in particular, which ended up being my medical school, and I got into the master's program. The master's program was what we call a feeder, which is just going directly from the master's into the medical program. And it was no joke. The master's program was very competitive. It
Right.
started off with like 400 people and ended with 100 by the end of the year. It was just 1 year of the first year of medical education. And they took the top 10% of performers in that master's year and they gave them direct admission into the medical school the following year. I ended up being in the top 10% after that master's program. That program was very challenging, just getting back into academic rigor after not doing it for 5 years.
Yes.
I was like, I have lost my whole mind. What am I doing? Why am I doing this to myself? This is torture. As you know, 1 year of intense kind of education can be very, very challenging. But it was nice to be back being a student. It was nice to be learning and kind of expanding on some of the knowledge that I had access to as an undergrad, but didn't get to really further explore. I then went into medical school. The first year felt very good, felt very solid because it was really just a redoing of that master's year. It wasn't until my second year, midway through my second year, where I started getting some intense, just what I would describe as probably burnout and exhaustion.
For sure.
And that started to show up with my exam scores and just how I was studying. I was very, very tired. I'm trying to figure out what got me through that second year, and I think it was probably my study groups, my friends. I like to study by myself, but we would message each other, check in, see how things were going, and just having that community of people who had done the masters who were with me was huge to get me through the rest of my second year. I then went into the third and fourth years of my medical school. And my medical school training was what we call a traditional model. So it was 2 years of the academics. The next 2 years were your clinical rotations. Some of them now are kind of intermixed and dispersed throughout with clinical training. But in my third and fourth years, I was in the hospitals. I was working with other residents in training, other doctors in training, and just kind of rotating through the various specialties. I enjoyed my third and fourth year, just being able to really do the work, to really get your hands on, and to think about how I just spend all 3 years just in the books to actually got to see what that looked like in practice. The only thing that was very challenging was just the exams that you had to take at the end of each of the rotations.
Yeah.
I had to take those many times.
Yeah.
And that was fine. I eventually passed them.
It's a journey.
And then I made it to graduation, and here I am, still a resident, still in training, not yet to the other side like my sister.
There, certain, almost.
But still in the third and final of 3 years of family medicine training. And because I am a glutton for punishment, I'm applying for an additional year of training just in osteopathy, or what we call manual medicine, for 1 more year.
Yeah.
So we're almost there. We're not done yet.
Yes,
but we're getting there.
It's a journey and you're almost there, but you are in it. You are in it helping patients. We are both in it helping patients. And we've talked a little bit about certain barriers that, we have experienced on our each individual pathway. We'll kind of delve into that further into our podcast and kind of highlight some of those barriers that are in the medical space. And that's financial barriers, barriers in regard to lack of representation in faculty within the programs, that there were certain instances in both undergrad and graduate school that I experienced where I felt like I was in a space of educating my peers as well as the professor in some spaces. And I felt very uneasy about that, but very much prepared to, but also inclined to educate individuals about certain things. And we'll definitely get into that as well. But our experiences are our experiences, and they've gotten us to the place where we are today. And I'm thankful and grateful for them, because they have definitely created us to be better providers. I think it's equipped us to, be able to take on a lot of things.
I agree.
As a new midwife, I feel that I'm still green. I've had a year under my belt, but I definitely still feel green in a lot of ways. But I definitely feel that I have grown in a lot of ways. I've definitely taken on more than I feel as someone in a new medical space should have, but definitely did it with grace, and was able to take care of many of patients. At this current date, I've delivered 19 babies.
Nice.
So I'm really excited about that. And that will, of course, continue to grow. As I'll continue to grow, I think learning is a continuum. You're never like a full expert at anything.
I don't know.
And that's with anything. I think that you're always able to learn and do better. And and that's kind of how I approach the way that I care for my patients. So with that being said, I also want to kind of segue into balancing personal life with our medical training experience. And I want to say that again, balancing personal life, because I don't even know if that is even a thing when you are really much honed into your craft, into your school, into your practice. I never felt like I really had a personal life when I was in school, when I was really, very much into it. And I think that the universe created a space where I wasn't in a relationship at that particular point in my life, because I didn't have the time. I was very much studying, making sure I understood all of the things that I was being taught or that I was self-teaching. And that we all know what that means. Everyone who's been in medical school, nursing school, you know exactly what I'm talking about.
Or just higher education.
That's higher education. But definitely someone who didn't take studying lightly. I wanted to master all of the things that was presented to me, so that when I get out into the world, where I'm just thrown to the wolves, I'm able to survive. And I'm glad that I, took on education in that way. But definitely balancing health, I would say my own personal mental and physical health throughout these times was definitely a challenge. But I will say it is very intricate and important to focus on those things in order to be, competent in the education that you're trying to receive at that particular time. So I would always try to make sure that I was working out, doing something active with my body. I feel like working out for me is therapy. So it was definitely helpful for me throughout my education experience. But yeah, that's kind of what I have to say about, balancing personal life and medical training. What about you, Samia? What were some of the things that you did, or did you find it challenging? Like, how was it for you in that space?
Yeah, I think putting it simply is that medical school is trash and residency is hell. And they are both very, very demanding moments of my life. Like medical school is very demanding. They always reference it as you are drinking from a fire hydrant.
Definitely.
I would say you're drinking from a fire hose in med school. You're drinking from a fire hydrant in residency. So you're just soaked the whole time. You can't breathe. You're not getting any water. You're just trying to figure out how to survive. And I think that you force and you carve out the things that you need in order to keep yourself well. There is, even just within your own peer groups, with your friends, like whatever your community is in both med school and residency, you lean on them, and they pour into you, you pour into them, and that helps keep you grounded and helps keep you well. They'll invite you to events when all you want to do is curl into a ball and do nothing. They will pull you out of your house, and so that you're making sure that you're being socially active, and that you're also just getting to see life outside of the confines of a medical education. I think that I've been fortunate to have a very supportive partner who came with me from California to New York when I did med school, and back to California now doing residency, who has kept me fed this entire time.
This man, he is the vegan the iron vegan chef.
He is. It has kept me very, very grounded in moments where I was incredibly stressed out. I think the biggest thing that I think about on both of these journeys is how much you hold all at once while you're still trying to just get up and do the things that have nothing to do with your medical education, because life is still happening even while you are very much in something that takes all of your time.
Yes.
I'm still trying to figure it out, still trying to be balanced, because I'm not. And that's just being honest. You cannot be balanced in residency. You're either like all in or you're not doing the work. And the work sort of like piles up.
For sure.
And also there isn't just the time to really carve out to do the things. But I try and exercise. I've been working out since I was 4 years old. So moving my body is how I best understand my body. I have a wonderful therapist, and I am shameless when it comes to plugging therapy. I tell everyone all the time, get a therapist. That's challenging. Don't worry about it. Get a therapist.
Do you have a therapist?
Yes. Who can help you? But I've had therapy since I was in med school, and that has been huge for my overall well-being. And I love watching television and film and watching it with my loved ones. And so those are the things that I managed to carve out time for as I continue to do this very demanding thing called training to be a doctor.
Definitely. Definitely. All right. And so with that being said, I feel like there is that space of self-discovery within your, our own specialties, and kind of what drove us in that direction in terms of being in, for you, family medicine and osteopathic medicine, and me being in the midwifery world and women's health. I just want to speak to, what was like the main fire under my butt, the main driving force of why I feel like I fit within the realm of women's health, and the reason behind it. And I feel like the reason I chose to pursue my field of practice is deeply rooted in an overwhelming rate of maternal morbidity and mortality in the United States.
Absolutely.
Like, this is something that everyone should know about. Women's health affects the community as a whole.
Yes.
So this maternal morbidity and mortality, especially among Black women, was mind-boggling, how the numbers are reflective of as if we're in a third world country. The statistics are staggering for Black women. They are 3 to 4 times more likely to die from pregnancy-related complications than white women. That's crazy.
It is.
So despite the awareness of this disparities, I've seen real change in practice when we actually are doing the work, acknowledging that there are disparities, acknowledging that statistically some individuals will have higher risk factors. We know all of this information. We've known all of this information for the last 15, 20 years. But what have we done? So with that being said, this is what gets me going.
Yes.
Like, I know that I can make a change within my microcosm, my specific space. And when I know I can make a change within that, it'll be a ripple effect and happen in other spaces. So that is what draws me to women's health. You know, we know the root cause that is systemic racism. Let's just be transparent. We have to be real about why things happen. But at the same time, we have to delve into why things happen. And then from there, find solutions. But we're always at the, the conversational piece. We're always talking about it. Everyone's talking about it. I don't know how many health equity conversations, meetings, forums I've had since 2020, and nothing's put into motion. We have the data. So, these are the things that, drive me to be more of a face, a person within this medical space for women's health midwifery. And also that within the practice that I practice at right now. Like, I want to be that person for individuals. And sometimes that's a lot. Because being one of the only people of color within an institution is wild, but it's real. So that's kind of like, I felt called to this space to enter and raise awareness, but to actively seek solutions at the same time within the community that I serve. I'm about making tangible differences and one patient at a time. Like, my patients' experiences affect me. Every single patient that I encounter, they change me. I change my practice based on their experience, based on their outcomes. Everyone is different. Everyone is not cookie cutter. So coming into this space, this is how I practice. This is what drives me. So,
yeah, very nice. And I just wanted to touch back on something that you said. One of the biggest things that are actually like statistically true is that when women are doing well, communities do well.
yes.
And that's around the world.
Yes.
And I think for me, I was drawn to family medicine mostly because I could not pick what I wanted to do. No, I think that the biggest thing was just that I actually, in family medicine, there is a lot of breadth of practice. You have to know to a certain degree almost all aspects and specialties of medicine. And I think that for me, I've always been interested in being able to care for someone from their birth all the way up until their aging process and up until their death, to be honest. And the field that allows me to do that is family medicine. I like that I can care for folks who are pregnant. I can care for adolescent populations. I can care for queer folks. I can care for my geriatric patients. The amount of people that I can take care of under the umbrella of family medicine is what attracted me to family medicine. I also like that you can be very flexible in what it is that you'd like to add to your repertoire and where you would like to stop with your learning in family medicine that I find is unique to the field itself. I also just like, when I think about my politics, my work as an advocate and doing advocacy work, family medicine was the specialty that sort of spoke to that the most overall, from being really in the community. It's the family docs, the main primary care docs that are like in the community and work directly with the community folks. And for me, going through my medical education, I originally wanted to be a psychiatrist. And why I pulled away from psychiatry just had more to do with, I was more interested in psychotherapy and talk therapy, and I would not have gone into medicine if I was going to do that. I would have gotten a PsyD and became a psychologist.
Right.
And so I think that as a family doc, you deal with a lot of mental health with your patients. And so it's not that I'm not doing that work. That work is still very much a part of what I do every day. And sometimes that's mostly of what I do in my patient visits with folks.
Right.
And I think that being positioned in a way where I can just see people, the continuity of which is just being able to take care of the same person in different stages of their life, is something that is really important to me. And that's what drew me to family medicine. I also was initially attracted to osteopathy as just the practice as an OMM practitioner, but I there were a lot of places at the time of the training where insurance wasn't covering manual medicine and using my hands to take care of the body. So I saw family medicine as an avenue for me to be able to take care of people with osteopathy in
For
the same
sure.
way.
I love that. And I love that, our pathways are definitely different, but I think they're very complementary. I think that we're able to communicate with each other and kind of ask different types of questions in regard to our patients. What do you think about this? What do you think about that? She's like prenatal patients. She asked me like, what do you think about this? I have patients that come with primary care issues, and I'm asking her. I think that we very much are complementary to one another, but yet very different. But like I said, our common goal is community health and awareness and advocacy. So I love that for us.
Yes.
And then I just want, before we, close it down, I just wanted to talk about like our reflection in terms of currently right now in this particular moment of growth, lessons learned, what has medicine taught us. I think that is super important that we have these types of conversations in terms of reflection, especially as providers. And I would like to speak to my experience.
Please do.
I definitely feel that having listened to your experience in medicine and actually listening to, others within the realm of medicine, my colleagues or past classmates in terms of their experience, it's wildly unsupportive.
Yes.
I will say, like, when you become a new doctor, a new practitioner, a new midwife, they are just throwing you out there to the wolves and they expect you to be successful. And at the end of the day, I'm very, very much thankful for my midwifery preceptor and very much thankful for my women's health MP preceptor, or else I would have sunk. They taught me so much, and I was so prepared for care because of them, that I was able to feel competent as well as provide the most effective and efficient care to my patients. And I'm thankful for them. But if I didn't get that experience or I didn't get that training, I definitely feel it would have been a different outcome for me. I don't know if I would have, survived that. But I think it's a cultural thing. I think that we need to shift the way that new practitioners, new doctors, new midwives come into a space in terms of training. It needs to change.
I agree.
The way that we approach healthcare needs to change. And that is one of the key things I think that needs to initially be addressed, especially me being on the earlier side of practicing. I would say also with my experience, I've learned that many systems in healthcare are more about making money than they're actually creating real lasting change. And a lot of hospitals, a lot of clinics, a lot of spaces that I've been into are all about the bottom line. And we have to be realistic about it. That's kind of like the American way. We're in a capitalist society, and this is what people look at. But I know that for me, that is not the way that I practice. And for me, that's not my passion when it comes to taking care of people. Like, I think that I would sacrifice the money that I make in order to make someone better. And so there's a very big disconnect for me when I come into spaces because I don't align, with the bottom line. I've seen it firsthand that the focus tends to be on procedures, interventions, pharmaceuticals. It's just a realm of things that I didn't necessarily understand until I was actually in it. And I don't think people understand that until they're actually in it. It often feels like the system is set up to keep the gears turning, to keep people in a specific place. And I think that's why it was compelling for me to kind of put that out there for us to like create this space so that we can talk about these things, how we can help other practitioners come to a space of realization and know that they themselves have to change the way that they practice in order to create better outcomes for individuals. And I think that culturally, we have to shift that mindset in order for that to happen. So that's kind of like my growth and learning and understanding of my current space and status within practicing. Hopefully that will change because I've definitely been very vocal. I'm not a very quiet person.
No, not at all.
When it comes to things that are not right, things that are not ethical. I definitely have always been someone who's spoken out about that or against that. So within my space right now, I actually submitted a program about mental health for individuals who are pregnant to the California Nurse Midwifery Association or Foundation, for a grant to help me get this program started. So hopefully that will come to fruition. If not, it'll be on the back burner, but still working in the, the background to get this off of the ground. But I'm always active and will continue to be active for real change.
Nice. Absolutely. Thank you. Can we get an amen? Yes. I think that for me, the biggest reflection, I echo what you say about there has to definitively be a culture change around how we train the next generation of healthcare providers. I definitely think that what's felt most in my program is that I identify what I call the old guard, or those folks who did not have work hour limit weeks. They were burning the midnight oil daily, working multiple 24-hour shifts, and also expected to show up and take care of people. And we're doing a bunch of night shifts and have very little regard to the new guard coming up who's like, no, we want to be well as we do this.
Right.
And what well means is that we have hours that respect the confines of the 80-hour work week or whatever that may be, because in medicine it's 80. And it's also just being, the unions were created for a reason in the 1930s during the Gilded Age, was to protect workers. We're going to talk about how they did not incorporate Black folks into those unions during that time period. That's another conversation for another day. But the work restrictions and the kind of protections that come from union movements back in the day were there for a reason. And are the new guard of trainees in medicine really, really are about honoring the self as they honor taking care of the community, because we fundamentally understand that if we are not well, we cannot help others be well.
Definitely.
I think for me, at this point, for myself, one of the biggest things that I'm thinking about and also kind of grappling with is how limited our healthcare system is as a whole, and how much of my thought around practicing medicine, practicing healing work has nothing to do with the structure that currently exists.
Yes.
And how I would like to think about ways of being outside of this, which I think with the recent kind of changes that we're experiencing here in this country, it is going to have to be a lot of creative thinking about how we can provide healthcare outside of what our normal structure of delivering medicine looks like.
Sure.
And I am also like really, really about giving communities their autonomy of their health. Because prior to our structured Western society of Kaisers and Dignity Healths and all these other health systems, people felt and knew more about their bodies than they currently do. We have stripped that identity from people to be able to identify like how they feel in their bodies, and have told them that the doctors know how to do it. But whenever I'm working with people and I'm working with patients, I tell them, you are actually the expert on your body and your experience.
Yes.
We are working as a team so that you can be well, but you're the expert.
Yeah.
You are the number one person. You know your body more than I do, and you can articulate to me what you're experiencing more than I can do for you. but I'm just making sure that all the decisions that you make are informed decisions. So I'm really about returning that autonomy back to communities so that they can feel good from themselves and begin to kind of do some healing from within and expanding to other communities around them.
For sure.
And I think that's my biggest reflection right now.
Good.
Is how to burn this down.
How to restructure this. Like, there's got to be a different way. And I think that, creating these spaces that are for action. We're not just here to just have a conversation. Like, we're actively participating in the way that we practice in these changes. So I think that that's super important as well, and being reflective of that. There's always that self-check-in too. Like, we're not here like looking at the system, and yes, I'm using quote fingers. We're not just looking at the system. We have to do some self-reflection. Like, how can I change my practice to better individuals? And I think that there needs to be a shift in that space with many of providers out in the world, because like I had mentioned before, like, everyone is not the same. Everyone is not and doesn't fit a specific mold. So we have to think outside of what you said earlier on, this confined space of like, this is what medicine looks like and this is how we have to practice it. And that's not the truth. So yeah, I think that we should do some self-reflection, consistently throughout these podcasts so that we can speak to the masses, speak to our colleagues, speak to the patients in regard to like what is really going on, in these spaces. So I would like to start to shift over into ending this episode and kind of getting you into a space of what to expect for the next episode. In the next episode, we'll be diving into a topic about historical trauma and healthcare and trust. We'll explore the deep, lingering effects of historical injustices, like medical experimentation, segregation, and systemic racism, and continue to shape the way of marginalized communities and how it interacts with healthcare today. We'll talk about the erosion of trust that has occurred over generations, how it affects health outcomes, and what needs to change for real healing to take place. It's going to be a conversation you won't want to miss as we examine how past trauma impacts present-day healthcare experiences and what steps can be taken to rebuild trust and create a more equitable system for all.
Yes. And if you're listening to us right now, we would love for you to like, subscribe, share, and just join in our conversation with us on all major platforms.
We are on YouTube. We are on Instagram. We soon will be on Spotify, so listen out for that.
Yes.
I'm Akila.
And I'm Samia.
And thank you for joining us for another episode of
Sistars in Medicine.
Stay curious,
Be well,
and we'll catch you on the next episode.